I decided to do the pain rehab program because I wasn't finding any answers from doctor after doctor that I would go to see. And my physician recommended that it would be a good thing for me to do. Prior to coming into PRC, I spent most of my time either on the couch or in bed. I was very low functional. I tended to stay in bed, till 3 or 4 in the afternoon, and I would only be up for a few hours a day. And, most days probably not even get dressed, just wear my house clothes. I was not working. For several years, I wasn't working anymore, so I just basically was really low functioning, and just had let myself go pretty much. So after PRC, at this point, I am back to work. I get up at the same time every day. I go to bed at the same time every night. And keep a good schedule for myself, which helps me to, be functional. The thing I struggled with a lot during the program was just I was still at such a low functioning level. It was hard to stay awake during class because my sleep was still so messed up. And, you're used to taking medications, and then, after a few days, they start to, taper you off of those. So you're physically going through some things. And so you have to push yourself to, do the best you can and be there and, make a decision to, buy into this program, that this is going to work. And yeah, this might not be pleasant right now, but, this has to work for me. So I'm going to try to do my best and just try to do everything they say. I would say my first biggest challenge when I got home was that all of a sudden, when you're in class, you have classmates and PRC staff to support you, like, day to day. And when you go home, all of a sudden, you might have a supportive family or friends that support you, but it's different because it's like a community of people that understand what you're going through. So when I got home, I felt a little bit like, oh, they're all gone now and I'm on my own. But I made an effort to reach out to classmates and stay in touch with the people that I was in class with. And that really made a huge difference because we held each other accountable to stay on track with what we learned at PRC. I fit the PRC lifestyle into my regular life by, a lot of it was just trial and error. If something did not work, then I just was like, well, I better find another way and make it work. Because for me, I knew this program had to work because I knew the alternative was not what I wanted and not what I wanted for my life. So if I found, something that wasn't working, I just went back to the schedule, my planner. My planner is like my lifeline. I still use that planner regularly every day, and I stick to it. writing it down and just making that plan. And that has really helped keep me on track with things. I use it all. I'm not kidding you. I'm serious.
Okay.
I really do. But it wasn't like that from the get-go. It's you slowly start to integrate these things that you learn, the different techniques and tools that PRC teaches. When you first kind of start, it's like you're making a life change, and it's not just like snap magic and you're fixed. Over the course of time, applying all of these things, the biofeedback, the moderation, the exercise, the scheduling with the planning, the cognitive behavioral therapy, all of that, just the more that you do it, then eventually you'll start to see changes. I feel like after PRC, even though it didn't happen right away, it's been a couple years of applying everything from the program, but I feel like I finally have gotten a life back, some kind of a semblance of what we know as a normal life, as opposed to what I was prior to PRC. I have a job now. I never thought I would be able to work in my field again, and I am, and it's bringing me so much joy and happiness. So I think before PRC, my family and friends were mainly, they wanted to see me get better. Of course, no one wants to see their loved one, struggling and things. But I think they were just like me, looking on the web and just, find a doctor that can make the pain go away, and, well, just take some medicine for that, or, whatever. They were also just kind of grasping at straws and looking for the answer, what's going to get you better, because they don't want to see you suffering. So I think it was really helpful that during PRC, my family was able to come to the family day, where you learn from Dr. Slutton and the staff about what your family member is going through. And I think that really helped make a difference in the way that they were viewing what I was experiencing. When I first got home, some of my loved ones thought that I was just going to be instantly fixed, that after the 3 weeks, everything's going to be all changed and better. She's not going to have any problems anymore and all of that. But that's not reality. I still had quite a mountain to climb, I guess you could say. So I think once they realized that, they were still supportive, but, it's important to, I think, for them to understand that when you get home, you still have a lot of work to do to make the changes that you want for your life. I would say that my social circles have changed, because before the program I didn't really have any social circles because I was in bed all day. So now I get out every single day. I see other human beings every single day and talk to other people. And I have to say, it makes a big difference in my way of thinking and just that human interaction. You don't realize how important it is, but, just getting out and socializing and being out with other people every single day is huge. Well, if I hadn't gone through PRC, I think I'd probably still be on all the medications, probably still be in bed, probably still be really depressed, and not have much of a will to do much of anything because, you don't feel good, etc. I think that because of PRC, I've had a ton of opportunities come into my life that I would not have had I not done PRC. It's a lot. To start with, I've lost almost 60 pounds, and that, can be accredited to, starting off in PRC, I just was doing basic cardio, and I wasn't doing that before, so that was, one step towards getting into the exercise world. And once I started doing that, I really liked it, and decided to continue with exercise and fitness, and changing my diet, which has helped me feel a ton better. So the opportunity to incorporate fitness into my life has been one thing. Another thing, another opportunity that I've had is to become more independent. I think, prior to PRC, I was still in a really dependent situation on family, friends, and whatnot. Financially, physically, emotionally, all of that. Now, I feel that I am, I've moved out from under my parents, so I'm kind of like living on my own again now, taking care of my own bills and things like that I was letting my family do for me. I'm doing that now. So the other opportunity that I have had is because of getting myself back to health and a higher level of functioning, I have also been able to get back to work. And that's been a huge opportunity and just something I'm, super excited about. I would say if you're thinking about doing this program and you're looking for something that's going to get you back on a better track with life, I would say you should definitely do this program because it has changed my life in ways I never thought or imagined that it would. And if you really, come to this program and buy into this program and make a decision that it's going to work for you, it will. Advice that I would give to current PRC patients would be to take really good notes, ask questions, because I think while you're in the program, that's the time to do it is, while you're there, if you think of a question, don't be afraid to ask, just try to learn all you can while you're there and focus in class, and know that, PRC is a supportive environment, and it may seem a little bit scary. I know it was when I first started there, but these people really do care about you, and they're here to help you. So, before PRC, first of all, I am a musician, and I was a music major in school, and that's what I went to school for, was to teach music and play music. And after I had started having my chronic problems, I quit playing the piano, and then eventually lost my teaching career in music as well, just because I wasn't able to function. So one of the things that happened when I came to PRC was that there was a piano downstairs, actually a couple of really nice pianos. And so my nurse told me about that and said, why don't you go down there and, play some piano, or whatever. So I started going down there and playing, and then the next thing I knew, after I graduated, I was coming back here to play for some patients during their class time. And I started coming back, maybe once a month or so, and playing piano for the current PRC patients. And so that kind of got me started getting back to, doing something I enjoyed again, something that I was passionate about and had given up. And there's a lot of joy in, like, getting your hands back on that again, and just finding joy and happiness from those things that you hadn't done in so long, and getting back into those things. So that's one of the really cool things about the program, is it teaches you, by applying all the things you learn, you're able to function better so that you can go out and enjoy life and have fun and all of those things. So I started doing it, that way. And then eventually I got to a point where I was, not working, and I was like kind of bored sitting at home and whatever. So I was like, you know what, something's missing. So then I started looking for a job, and I was able to find a job teaching music to ages 3 through 5. And I've only been doing it for a month, but I really like it so far. And it's really fun, and I'm really enjoying being back doing something that I never dreamed that I would be doing again. So it feels really good.